It's good to get all the way around the greater trochanter, but you don't want to go all the way to the anterior side of the body where the ASIS is, the anterior superior iliac spine. It could be ticklish and vulnerable, so you do want to see how I'm in front of the greater trochanter. Muscles attached there, and that's good to massage that, but not getting all the way in front of the body. Similar to the trapezius work, pulling across the table, I like to pull on different angles. So sometimes you're going to kind of come up towards the back. Integrate some of it like the low back lapping stroke all the way to the other side of the table. And so you've got the thoracolumbar aponeurosis, the lats, the quadratus lumborum, all going to here. And then you've got glutes coming from the other side all the way up to here. So these, like when you come up to the, like a butterfly stroke and you slow down and really sink in at the top, when you come down on the butterfly and you really sink in here, same thing on this whole area. Where these attachments are is a great place to sink in and focus. Normally, again, I would integrate this with a back massage a lot, but in the interest of time, we're going to really focus on the work directly in the glutes. Since these are big, strong muscles in this area, I almost always use a lot of soft fist work, a lot of forearm, a lot of elbow, not a lot of fingers or thumbs.
So when you do a back massage integrated with the glute work, you're undraping exactly how you're undraped right now.
Exactly, yeah.
And you would, once you're done with that and the back and the glute work on this side, depending on, I'm not sure if you do one half first or whatnot, but you would drape that back down and then move to the other side, undrape that, and then go that way.
Exactly.
Re-drape and then move to the legs.
Exactly,
Okay.
yeah. So one stroke that really warms up the area well and gets a lot of work done quickly, it's kind of like a variation on petrissage, is on the lateral border of the sacrum right here and on the inferior part of the iliac crest. You're going to make a like scooping, like carving out the inside of a pumpkin. And then your other hand is going to be for the attachments all the way around the iliac crest, doing the same thing. And your fists are soft, they're not holding tension. Straight wrists, leaning with your body. And as you do this, you can increase your pressure as it warms up. You can see the tissues getting a hyperemic pink response. And as I work through the layers, I can feel where there are little spokes of tight muscle. A lot of people who've had a lot of massage already know how amazing work in this area is, and they really expect it. Sometimes people who haven't had as much massage may be a little more apprehensive about this area. And it's kind of funny, it's one of those areas that people don't necessarily, unless they've really got obvious hip and low back problems and pain, it's one of those areas that a lot of people don't notice how much tension they carry there until you start massaging the area, and then they realize it's like just such a crucial part of the massage, and some of the work that gets the most work done quickly. Sometimes I'll have work with clients who maybe we only have time to really focus, let's say, 40 minutes in this area, just integrate the low back and hamstrings a little bit, and they literally say they walk differently. That it just, I mean, to use their words, they'll say that it, it fixed it, and that they just completely walk differently now because of it. So when people have low back issues, whether it's just stiffness or something else, almost always the gluteal area, including the lateral rotators of the hip as well as the hamstrings, are almost always involved. So you want to, work with the hamstrings. Now, a lot of people, if they're not comfortable working directly on the skin, or they leave on their shorts or underwear or whatever, a lot of those people are comfortable working through the drapes. And of course, you can do a lot of this work through the drapes when you need to.
And how would you let them know that, like, during their intake or whatever, that you'd be undraping that area, or if they're comfortable with that?
Yeah, let them know that could be part of the massage if they like, and are they comfortable with that. And a lot of times, different clinics use different intake forms, but a lot of times they will even include a part that just is like a picture or a checkbox of which areas to work and which areas not to work. Integrating this on top of the sacrum right here is very important as well. The multifidi are right on the sacrum itself, as are fascial connections. And people, especially women, really often have an anterior pelvic tilt. And as part of that, you'll see an excessive curvature here. And it'll be kind of like this, and there'll be a lot of bound up fascia right here. And the thoracolumbar aponeurosis is a very common area to have thick, bound up fascia. And so when people have an issue with elevated hip, and so for sure quadratus lumborum is involved, oftentimes the hardest part for massage therapists is kind of to address the thoracolumbar aponeurosis because it's so thick to get into the quadratus lumborum. Now, when we study those muscles in particular and do more specific injury work, we'll get more specific with the QL, which is the nickname for quadratus lumborum. You could see some of the work I'm taking up and over the iliac crest, integrating, because the fascia that attaches above and the fascia that attaches below is all going to be connected. So sometimes you're ending right at that origins and insertions right there on the bone, and sometimes you're going up and over. So because people are really bound up in this area, it can be really nice to do long, lengthening type this way kind of strokes.
Most of your pressure is coming from your thumb, or?
My elbow.
Okay, you're on the ESG going into the iliac crest?
I was actually right on the top of the sacrum.
Oh, okay.
So what would be an area, like, if for women back here is a issue, but for men, would it be the same thing? Should we focus there as well, or?
It's a good question. Men are often very stiff in that area as well. They just don't as frequently have as much of an anterior pelvic tilt going on with it. They also get the low back stiffness and a lot of stiffness around here in their hips. Not as common the actual anterior pelvic tilt though.
Is anterior pelvic tilt like this?
Yep, exactly.
Okay.
Yep,
And then posterior is this.
exactly.
Do people ever have a posterior tilt?
Yes, yes. Not as common, but. Alright, so now that it's warmed up, I'm going to sink in with a lot more pressure. And there's little like spokes on a bicycle wheel coming off of the greater trochanter. So I'm going to sink in. And I could do a linear friction, a prolonged ischemic compression, a cross fiber friction in these muscles.
Are you going around the trochanter, or are you going all the way across?
I'm taking the muscles that are tight right here and stretching and melting the ones right there rather than crossing over at the moment. But basically I'm going to go work my way around the greater trochanter and see what's tight or short or. It can be comforting to actually get your arms supporting their iliac crest, but make sure that your chest and your tummy, the rest of your body isn't on your client to do that. Also, I think it's a good idea never to cross the gluteal cleft. So if I'm like applying pressure like so, I don't want to kind of do right across the gluteal cleft. You want to make all of your movements in this area deliberately therapeutic and very clear that you're working with the muscles. You don't want any movements that could be sensualizing or sexualizing that experience. And it's usually pretty tight for people right here. Slow, heavy, don't use the tips of your finger here or it'll be ticklish. This is one of those areas that if you're really specific with the muscles that are a little bit more anterior, this is an area that a lot of massage therapists who are not that precise in their palpation or their knowledge of kinesiology will be much more general with the work and in many cases won't even get to the origins and insertions effectively. And it's going to make a big difference in how much effect you have. And I feel this could shift her posture if we stick here with this for a minute. There we go, and then you can smooth it out. There's some kind of crunchy feeling there, and that is called a paninculosis. And that is a big sign that there's a trigger point in the area.
You're working the anterior side of the trochanter.
Yes, and superior, yeah. integrating it to the tissues around it is very good. It feels like that tension in the low back that's connected to these muscles is effective with this kind of MFR release. And the pressure?
7.
Okay, great, thank you. One of the most effective areas to work there is the lateral border of the sacrum. And it's pretty amazing if you release the tense muscles on the side of the sacrum here, it really shifts the position of their hips, their whole pelvis, and how smooth their movement is. They'll feel it even if they're just walking. And they'll feel like more limber, more graceful. And now with my pressure, what you might not be able to see is I'm actually taking it inferiorly, so pulling and lengthening and stretching this way. So that tension that exists this way, we're pulling it this way.
And when you're working the glutes, you always want to pull inferiorly or down or towards the knees.
If I'm on the lateral border of the sacrum, yes.
Yeah.
But right in here in the iliac crest, you can be pressing up into that.
Okay.
And on a 1 to 10 scale, if 7's perfect, 10's too deep, 1's too light.
7.
So you're lateral and inferior to the sacrum.
Mm-hmm. And it's starting to give way. It's melting, it's getting softer. These are big, strong muscles though, so I'm using quite a bit of force, but not in a forceful way. I'm letting her tissue invite the process and going with how much intensity she wants, but as far as just like pounds per square inch, I would guess I'm using, I don't know, 30 pounds of pressure to stretch and press. There we go. This is great all the way to the ischial tuberosity. All of the hamstrings attached there. And on a 1 to 10 scale, 7's perfect, 10's too deep, 1's too light. 6. Enough.
So are you still lateral with your pressure? Or are you going into...
Now I'm going this way,
Okay.
actually this way, into the ischial tuberosity.
So do you change your direction of pressure application based on the direction of the fibers or the trigger points?
The direction of the fibers as well as the shape of the hips. So, you know, the hips are like a big bowl, and so there's a lot of round shapes going on with round and triangular muscles coming off of the round shapes. And so you're feeling a lot of the angles of the helping the pelvis, which should actually be able to roll, tip and roll and move like that. You're helping pull on different angles to facilitate that. So I'm not just focused as like, let's say, an individual muscle like that, and I'm just tracing the fibers. If I'm applying a lot of pressure on this muscle, I'm simultaneously feeling, okay, well, which angle is going to facilitate movement in her hips at the same time, and a release of any tension there. Which sometimes is this way because of the tension here, but sometimes you're actually kind of pulling out this way. And there's some good tension here, so scale of 1 to 10, where's that at?
7.
Okay. Now it's melting. What does that feel like to you?
Relaxing.
Oh, good. As it's melting, coming to some spots that are tighter than others, changing my pressure and speed to let it keep melting. Sometimes you gotta be lighter, sometimes you gotta be heavier. Sometimes you just gotta really back off and give them space. You're like almost like a witness, just listening and supporting. That gives them the space to let go instead of the quality of you're tight here, you're tight here, you're tight here, you're tight here, you're tight here. Instead, you can be finding those tight spaces, but meeting them in a way where you're giving them space and they can let go if they want to. A lot more happens that way. Sometimes I'll get really low because you want to get the muscles as they come up like this as well. And I'll show you more a day when we undrape from the leg as well, how you can come all the way up the leg and do this. Is that too much?
Perfect.
You're not crossing the greater trochanter at all, are you? You're going around it?
Yes. Yeah. Ooh, there's some good tight spots. That's going to release something we haven't released yet. And 1 to 10, 7's perfect.
7.
Do that longer, but I want you guys to have time to practice as well. Redraping. Bring it up there first.